Working with American Indian Children and Families, a training curriculum for new caretakers and providers. This presentation is designed to be a starting point for those working with Native American children, youth, and families. It will provide a basic understanding of the complex issues that contribute to positive identity development, parenting, and family systems for Native Americans in a cultural context.
And just like everything else that we do, everything starts with a prayer. So what I'm going to do is I'm going to offer this tobacco to the Creator and before we start this fire. And because when you ask for something, you got to give something too.
Statistics. According to the most recent statistics produced by the United States Census Bureau, there's an average of between 2.5 to 4 million American Indians in the United States. The state of South Dakota is home to over 68,000 American Indians. Unfortunately, the statistics regarding victimization and abuse are staggering for American Indian populations. Currently, American Indians and Alaskan Natives have a violent crime victimization rate that is 2.5 times higher than the national rate. In addition, American Indians with an annual income of less than $10,000 reported the highest rate of violent victimization, 182 per thousand, and 1 in 6 violent acts against American Indians involved an offender who was an intimate or family member. While violent crime against whites and blacks is primarily interracial, almost a third of American Indians, or 30%, were victimized by other American Indians, according to a Department of Justice report, 1999.
And when you look at the reservation life, like if you were to sum up the issues that everyone faces, what are they?
I would say alcohol and drugs are a big thing. Teen pregnancy and just pregnancy overall. A lot of welfare going into play because of the lack of jobs or the people not having any money. Sexual abuse, violence. There's a lot of domestic violence or just violence in general. Kind of whirlwind of things.
Abuse rates are staggering. American Indians have the second highest in the country, 20.1 per 1,000. Some reports show 80% of Indian girls and 22% of Indian boys being sexually abused. Although American Indians make up only 1% of the national population, 3% of children entering out-of-home placements through the welfare system are Native. Many states are severely overrepresented. For example, in the state of Washington, American Indians make up 2% of the population, but 9% in the system. In Minnesota, American Indians make up 1.8% of the population, but 13% in the system. In South Dakota, 10 to 12% of the population is Native American, and yet 62% of children removed from their homes through the welfare system are American Indian. According to Hodge, 1997, alcohol has been implicated in 50% of adult crime on American Indian reservations. 90% of all homicides with American Indians involved alcohol at the time of the act. 85% of suicides among American Indians were alcohol-related, and 75% of all fatal accidents among American Indians were alcohol-related. Unfortunately, substance abuse is often not the only problem facing American Indians. More often than not, substance abuse is comorbid with other mental health disorders, usually depression. Historical context. In order to understand the current functioning of native populations, it's important to understand what shaped that behavior. Many significant events occurred in the collective past of native communities, but for the purpose of brevity, this presentation will only be reviewing 3 significant events: the impact of colonization, boarding schools, and relocation. It's important to understand that the past is historically collective for American Indians. Despite the fact that there were hundreds of tribes who populated what's now the United States, each tribe had one thing in common: contact with Euro-Americans. Whether a Yakima from the northwest, a Cherokee from the southeast, a Pima from the southwest, or a Dakota or Lakota from the northern plains, all tribes suffered from contact and colonization, and all tribes were impacted by the policies that the United States government developed as ways to deal with tribal nations. Colonization. In order to understand the mental health functioning of individuals, gaining insight into the historical context that shapes them is essential. For native populations, this history is significant and continues to impact the generations that followed. Native history can be broken down into 4 different categories. These categories include pre-contact, manifest destiny, assimilation, and self-determination. Pre-contact, prior to 1492. Before Europeans began arriving on what some tribes called Turtle Island, now known as North America, native populations lived in great cultural diversity. Although there are over 500 nations within the United States, most can be broken into different groups based on regions. For example, the Great Plains, the Southwest, the Northeast, the Northwest, Arctic region, and the South all had different ways of functioning within the geographic environment, different types of shelter and food gathering methods, and different political and societal roles within the community. The communities in the Great Plains region were more nomadic and moved with the herds. Their populations were organized into small bands that were fluid and yet often interrelated by political, linguistic, and cultural ties, similar to small states that make up a larger nation. They lived in homes that were mobile and portable, which allowed them to move easily. Natives of the Southwest region built permanent settlements often associated with agricultural societies. Their populations were organized in cohesive groups or clans that were maintained by familial and ceremonial cycles. The populations in the eastern regions developed complex systems of government which would ultimately inspire the United States Constitution. There were also Arctic regions, the subarctic regions, the northwest coast, and far west. The important thing to remember is that each region, each nation of people, had its own set of belief systems and ways of functioning. The common core of all these beliefs is that the tribes protect their families, their communities, and the world they live in. Manifest Destiny, 1492 to 1890. European contact was disastrous for American Indians. There were 3 main contributing factors that decimated native populations. 1. Epidemics cut the native population in half. 2. The need to civilize the savages on the continent. And 3. Treaties were made and broken with the tribes. With the arrival of Columbus came an onslaught of diseases. The outbreak of smallpox, cholera, pneumonia, and syphilis produced massive death amongst the various tribes. When this happened, native populations lost many people, including medicine men and women, elders, as well as many young. Natives had no resistance or immunity to counter European diseases, and the medicines that had proved helpful in the past were not effective in healing the new diseases they contracted from the Europeans. The loss of elders and medicine men and women, the true leaders and wisdom holders, was a further blow to native populations ravaged by epidemics that effectively annihilated some tribes and diminished all others. Loss of economic, political, and military strength, combined with the loss of leadership and social structure due to the epidemics, further diminished the resiliencies of most native systems. The destabilized condition of the tribes weakened their ability to negotiate with Europeans who desperately wanted land and resources. The process of civilizing the native population involved the emergence of residential and boarding schools. These schools, run by various churches, set out to Christianize and teach children to mimic mainstream culture. The intended purpose was to make it easier for them to function in the new world in which they lived. However, these schools used harsh discipline and abuse as a way to teach these lessons. The children in these schools were not allowed to speak their own language, practice their tribal traditions, or see their parents for many years. They were taught that being Indian was bad, and after long periods of time, generations of Indian people believed it.
But I think some of them, they're kind of ashamed how they was raised long time ago. They're ashamed to tell their children or the grandchildren, just like they're kind of ashamed how they raised them. I don't know. Kind of, some of them have a hard time. When you ask them, how you, I don't remember, I don't know, I said that, I don't remember. I didn't, they know, but they wouldn't come out and say, how they went, how they was raised and how hard it was long time ago, and, in 30s and 40s and 50s and 60s. In 70s, it's a little bit better,
Treaties were made often with various tribes to ensure land, water, mineral rights, and hunting and fishing rights on tribal lands. The tribes made these agreements or treaties with the European settlers because they saw it as a way to help their people and avoid armed conflict. The concept that a great nation like the United States would not honor their agreements was difficult for Native people to imagine. Assimilation, 1890 to 1970. During this time, Native populations had few choices. They could assimilate into mainstream society or deal with the consequences of non-assimilation. The United States government made serious attempts to eliminate the treaties and agreements made with tribes by repealing acts that were designed to help Native populations. These attempts led to a process called termination. Termination involved many ideas, including terminating federal recognition of the tribes, appropriating their land base, and moving people off reservations. Termination of federal recognition of sovereignty destroyed tribal autonomy and provided complete authority to states. Termination effectively stated that tribal people did not exist anymore, and that Indian people needed to entirely assimilate to mainstream values. Termination in practice meant that tribes would lose land base, cultural independence, and recognition as a people. These extreme measures to force Native people off the reservations led to an increase in social and behavioral problems that continue to persist today.
I remember sitting around the kitchen table at my grandma's house, and my aunts and uncles had come in. Everybody was sitting around talking about termination and just listening to the adults around me talking about what that could mean and where would we go. And they talked about what happened to other tribes that were terminated, and I remember when just listening to them talk, and it made me feel really scared and helpless, and hopeless too, because it's scary to think that all these things could be taken from us, just, with a stroke of a pen, because it did happen with other tribes. And I think there was probably a lot of discussion around that, all the while I was growing up, because when I look back at that now, I think there's a lot of fear attached somehow when I think about the termination era, and the not knowing, not knowing what was going to happen, not knowing if we were going to have our home, and I guess that's the best way that I can describe the feeling. Is that it was just really, really a frightening time. And even just talking about it makes me panic. Even now, it makes me panic. It makes me feel. I can feel that sense of hopelessness, helplessness, because when I think that if a child ever feels that the adults around them can't protect them, the mother and father, the grandparents, I think that it just, I just don't know how to describe it. It's really an awful feeling.
Self-determination, 1970 to present. The period of self-determination saw a resurgence of Native pride and activism. This was a time of new American Indian leaders, philosophers, writers, and political activists who advocated for Native rights. There are 4 significant congressional acts passed during this time period. The first significant congressional act that was passed during this time period was the Indian Self-Determination Act of 1975. It stated that Indian people had the right to control their own destiny and that tribes had ultimate control over the education and welfare of their people. It also ensured the protection of Indian lands and resources. Prior to this act, treaties were broken and native lands were often confiscated without the permission of or consultation with the tribe. The second significant congressional act that was passed during this time period was the Indian Health Care Improvement Act of 1976. This act provided for better health care services for Native populations, both urban and rural. It provided more provisions for those wanting to work with Native communities and allowed for more access to health service for Native populations. During this time, IHS, or Indian Health Services, emerged as the dominant healthcare provider for Native people. The third significant congressional act that was passed during this time period was the Indian Child Welfare Act of 1978, commonly known as ICWA. This act stated that tribes had full jurisdiction over child custody cases. The law required that the tribe is to be informed and present for court proceedings and be involved in any placement or adoption proceedings. Before this law was passed, Indian children were removed from homes at staggering rates and placed in homes or adopted to Euro-American parents without any regard to their cultural or spiritual identity. The fourth significant congressional act, the Indian Religious Freedom Act of 1978, allowed Native populations to practice the traditional religions and ceremonies of their tribe without interference from outside sources. From 1883, when Congress passed the Code of Indian Offenses, to 1978, it was illegal to practice any form of traditional prayer or spirituality. The passage of the Indian Religious Freedom Act was an important step toward freedom for Native people. Boarding schools. As discussed previously, boarding schools were set up as a way to assimilate Native children into mainstream society. Most of these schools were parochial in nature, and therefore run by various churches. Initially, the belief was that to save the man, you must kill the Indian. This is a difficult concept to understand in the 21st century, but it was a very real belief system in the boarding schools until the 1970s. With this belief system in mind, it's easy to see how rampant abuse and violence was the norm. Research indicates that the boarding school era had detrimental effects on the generations of Native people who attended them. The type of abuse many Native children experienced growing up in boarding schools led them to believe that being Indian was bad. That self-loathing led to addiction, violence, and abuse. Not only did Native children grow up to hate the Indian they saw in the mirror, they could barely remember the traditions of the past and the appropriate ways to parent once they became parents themselves. In place of traditional parenting values and practices, parents passed down the self-loathing and shame to their children. This negative and critical belief was reinforced by the harsh conditions and abuse experienced by the next generation of children that entered the boarding schools. Understanding that boarding schools were terrifying and demoralizing for the children is only part of the picture. The sense of loss and grief that mothers, fathers, and grandparents endured as each of their children was removed from the home, sometimes for years, is difficult to comprehend. To lose a sense of meaning and purpose in life as a parent or grandparent can be overwhelming, and to acknowledge the alienation that resulted when children returned home years later, forever changed by their experiences in boarding schools, added to the disintegration of family systems and contributed to the intergenerational distress. Although government boarding schools still exist, there are currently only 3 government-run boarding schools in the United States. Most boarding schools are now run by various Indian communities or are overseen by local tribes. Relocation. Relocation was another policy passed by Congress and implemented as a way to move Native communities off ancestral lands and off the reservations. If Native populations could be forced to assimilate into mainstream society, reservations would not be necessary, and tribal lands could be appropriated by state and federal government. Unfortunately, services were not provided, and Native people did not know how to deal with the stress of living in urban communities, far from their families, their traditions, and the land. This led to significant problems, primarily a rise in alcoholism and homelessness. Multi-generational trauma. Multi-generational trauma refers to a series of effects that occurred as a result of colonization, boarding schools, and relocation. Briefly, the concept involves the negative consequences of abuse, low self-esteem, identity conflict, and addiction are carried into the generations that followed. Instead of learning to parent in the appropriate and traditional ways of the tribe, children who attended boarding schools were often subjected to physical and sexual abuse and criticism, which affected their ability to parent. When children returned home from these environments, they were tainted, separated, and unable to fit back into the systems that had felt so natural for the generations before them.
There are some people say that Indians today have a living trauma in their life with history, because of all the things that happened to us. And then generations, 2, 3, 4 generations ago, they never got to deal with it. So that, that they can heal, they can make that adjustment. You know, they're all lands taken away from them and put on reservations, and you know, that must have been traumatic, you know, to be in someone free people, and then you're hoarded and being put on some other part of the land and can't leave, gotta live off rations, and yeah, and you gotta do ceremonies and you know, underground or in silence or in secret, you know. So yeah, our grandparents suffered a lot, sacrificed a lot for us today.
Assimilation happens when an individual or a group is absorbed into another culture. Acculturation means adopting another culture and its social patterns. There are 5 levels of acculturation that will impact the type of interventions, programs, and services that may be effective with Native children and families. The severity and type of isolation and sense of loss experienced by Native children, youth, and families will influence the type of interventions needed. Effective interventions for Native American individuals or families will need to match the appropriate level of acculturation as well as acknowledge the severity of symptoms. Traditional, transitional, marginal, assimilated, bicultural. The traditional person. Traditional people are less likely to seek outside help for distress. They're more likely to seek traditional methods of dealing with problems, such as utilizing a traditional healer or attending ceremonies. The transitional person is one who practices but is not embedded in the traditional beliefs of the tribe, but also has not fully accepted the norms of mainstream society. This type of person may feel a bit unsure at times about identity and may not feel comfortable with either mainstream or traditional beliefs. The marginal person is one who is unable to live by the cultural teachings of their tribe and is also unable to live in dominant society. This is the type of person most at risk for developing mental health problems. The assimilated person is one who embraces the dominant culture and feels accepted in that culture. This type of person may seem detached from their heritage and may even deny the existence of their Indian bloodline. They are often at risk of developing identity issues later in life that may need to be addressed if difficulties arise. Finally, the bicultural person is one who is accepted in both dominant society and tribal society. This type of person is the most functional in that they are able to utilize both mainstream and tribal belief systems to function in healthy and productive ways. Identity issues for Native Americans are connected to acculturation, and yet a little more complicated in that they stem from not truly understanding what it means to be a member of a tribe. Many Native people who went through boarding schools were taught that assimilation was the only acceptable way to survive. Some of these individuals may not value their culture and are likely unable to pass it down to their children. The inability of parents to pass down a positive cultural identity can become problematic for Native children. Children may begin to look at themselves in negative ways, and the parent's low self-esteem and shame may reinforce the child's negative self-image. This loss of identity is significant, especially as the children reach adolescence and struggle with where they fit into the world. Individuals experiencing confusion about cultural identity often waver between mainstream culture and their heritage, which they may not understand. That uncertainty places them in the marginal level of acculturation and most at risk for developing mental health issues. Comparison of American Indian values and mainstream American values. It is important to note that the value systems about to be presented are not meant to suggest that one value system is better than the other. It is simply acknowledging the fact that considerable differences exist between Western Euro-American culture and tribal cultures. It will be presented in table format, primarily for ease of reading and referencing. It is also important to note that not all Native people follow these particular beliefs, just as not all people in mainstream society follow the value norms listed in that category. American Indian values. Mainstream American values. Group life is primary. The individual is primary. Extended family is important. Nuclear family is primary focus. Respect for elders. Respect for youth and success. Orientation toward the past. Orientation toward the future. Character is source of status. Educational degrees is source of status. Cooperation, generosity, sharing with others is vital. Competition, savings, and individual ownership is vital. Emphasis on responsibility for family and personal sphere. Emphasis on authority and responsibility over a wide area of social life. Work to meet needs. Work for work's sake. Seek harmony. Seek progress. Pragmatic, accept what is. Must change or fix problems. Time is always with us. Time is negotiable, use every minute. Personal caution, indirect criticism. Personal openness, direct criticism. Holistic approach to health. Focus on specific ailments. Self-exploratory child-rearing practice. Directive-oriented child-rearing practice. Tribe responsible for child. Individuals responsible for child. The list above emphasizes key value differences impacting family systems and child-rearing practices between mainstream culture and American Indian culture that are important to examine when working with tribal youth and families. Specifically, the focus on self-exploratory parenting styles, the definition of family and the concept that child rearing was the responsibility of the whole tribe and not just that of the individual parents.
I was taught that there was certain I don't know if you call them titles. What do they call titles for each family member? So, there's a word for older sister, word for older brother. There's words for male cousin, female cousin, and I think there's probably even the female in masculine and feminine difference too when you're talking about cousins. So there's a different word for older sister, different word for younger sister. And to me, I guess what I understood was that it gives you a sense of responsibility, and it defines boundaries. It defines what your relationship is going to be with that person. Because if it's an older sister, for example, then what it means is that she is going to guide you. And if you are an older sister, you're going to guide someone. If you're a grandmother, for example, then you're going to have a different relationship with your grandchildren than you would your children. So I think it defines what your role is. And probably since about 1978, when when the Indian Freedom of Religion Act was passed, then people begin to understand how important those things are, using titles. And I don't think that the family was ever less important because they didn't use the titles, but I think once we started that again and start using titles again, I think that it brought back that, it brings back that respect, and it brings back that sense of responsibility that you have to other family members.
The concept of family for Native Americans is very different than mainstream Euro-American culture. Many, if not most tribal people believe that family is a large extended family system which can include people who are not blood relatives. Native families often value the idea that a child learns best by experience, without the direct intervention of the adults around them. This is contrary to the concept that children should be taught right from wrong. Another concept that differs significantly from Western Euro-American belief was that the responsibility for raising children did not fall to the parents alone. Grandparents, with the help of the community, took the primary responsibility of raising the children in most tribes. Those concepts followed Native people throughout the assimilation process. However, nowadays it can be more complicated. A parent cannot assume a family member will be able to care for their child because, with the onslaught of abuse, addiction, and violence that resulted from the interruption of traditional lifeways, having others care for children can be very dangerous. Assessing the level of acculturation of the youth or family is necessary to develop interventions that can increase resiliencies in the individual or family system while still respecting cultural values and developmental stages. Ethical concerns. Professionals and paraprofessionals are obligated by standards set forth by state and federal laws and professional codes of ethical standards. Professional organizations and agencies also set agency standards of exactly how to act when working with people. Pivotal to this is the ability to understand another's perspective and to consult with others who have the knowledge when uncertain. It is important to understand the individual's or the family's perspective through a cultural lens and experience. This comes into play when working with children and families of a different culture. Acting in an ethical manner means that people working with different cultures will seek out the knowledge and understanding of the issues within the cultural context and search for and recognize the strengths of that culture. This isn't to say that one must accept the Native American cultural view or family system as more right or wrong than mainstream family systems. It means that the Native American cultural worldview has merit and influence and may be more congruent and appropriate for the family's life than trying to impose other mainstream cultural values on the family system. Ethical concerns involve what we do as individuals and as organizations to make sure that the work we do is in no way going to harm the people we are entrusted to serve, whether this be a client or a foster child. However, there are some specific concerns that are geared towards individuals, foster parents, and organizations serving tribal communities. Individuals working with Native American youth must always do what is going to be in the best interest of the children. The cultural values and worldviews of the child and the child's family must be a priority. As foster parents of Native children, it is important to learn as much as one can about the specific cultural background of the child. Each tribe has unique characteristics and histories which can help one understand the background of the child and that child's family. Often, when a child is removed from the family, the foster parents are given very little information, and they are often left unsure how to help, or even if they should do something different because this child's native. The best thing a foster parent can do is to be aware of value differences and make choices that are developed for the individual child, and not preconceived ideas of what Native people are like or should be like. The key for organizations is to place high value on and encourage cultural competency in staff who work with tribal children and families. Although there are universal standards of care that apply to everyone, the ability of an organization to understand the complexities and contexts of any Native community it works with shows the true vision of that organization. Beyond hiring culturally competent staff, an organization might find that enabling all staff to be sensitive to the world around them, appreciate diversity, encourage personal growth and the exploration of other communities, as well as to encourage continuing education and training, will benefit the organization as a whole, besides improving its ability to serve American Indian clients.
I can remember one high school professor who talked about Native history. He's the only one. I had one middle school teacher who showed a video of like a war battle between like the Iroquois and some army. But other than that, it was like watching westerns like in school and seeing like the Indians and the cowboys, and always just being completely like it wasn't talked about. It wasn't acknowledged. For me, I don't honestly remember Native history being incorporated into the curriculum. But there was that high school teacher I mentioned. He was very into acknowledging the history in the past, and I was so grateful to him for doing that. And I will always be grateful to him because he's like represented something to me, that he gave us the opportunity to create these skits based upon historical inaccuracies. And I did the Trail of Tears, and I had a group, I think there were 5 of us, and they were all white except for one friend, and I had them be the Native people. And I had them wrap themselves in blankets and walk through the classroom and talk about how they were being treated and beaten and relocated. And then we were actually, I don't know what kind of twisted humor this was to me back then, but we were actually the white men, me and my Indian friend, who were like in the courts being like relocate those savages, you know. And so we wore signs that said pretend we're white, and they wore signs that said pretend we're Indian. And I just remember like wanting to prove the point that there's so much that like people don't see or think about or care about. Mm-hmm. And like just wanting to be like, look, just stop and look at this. Like, it's uncomfortable, but
Mental health effects of trauma on Native children in placement. There are many different mental health concerns for Native children in placement. The 2 most common conditions are PTSD and depression. Post-traumatic stress disorder, PTSD, is one of the most common disorders seen in Native children in placement. This is primarily because children who ended up in the system often have experienced or witnessed a tremendous amount of violence and or abuse. Whether the trauma is triggered by the violence in the home or caused from being removed from the home, symptoms of PTSD may manifest differently for boys versus girls. Boys may be more physically aggressive with more pro-violence attitudes. They're generally described as hot-tempered and easily angered. They have a tendency to be impulsive with low tolerance for frustration and are more likely to fight, drink, and smoke than their peers. Girls will typically be anxious or insecure. They may have low self-esteem and have a hard time defending themselves against others, or may engage in self-harming behaviors. In addition, they are often socially isolated or lack the social skills necessary to maintain positive relationships with their peers. In very general terms, boys tend to be more extroverted, displaying their anger outwards, while girls tend to be more introverted, displaying their anger inwards. This trend appears to be shifting slightly as a growing number of girls display more aggressiveness.
The only times I've ever gotten in fights is when I know someone that I care about is in danger. If they're getting beat up or if there's like someone else coming towards them, like if they're gonna gang them or something, then I'll step in. First I'll try to talk to them, but if they throw a hit at me, I've never thrown a hit first, but if they push me or hit me first, then gotta defend myself and gotta defend the people I care about, so.
And do people get into a lot of fights around here?
Yeah,
The girls too?
yeah.
When girls fight, what do they do?
Pull hair, try to pull off the other girl's shirt. It's really dumb. I hate fighting. I feel really stupid afterwards, but
Depression is one of the most common mental health disorders seen in Native American youth and children. For the past several decades, rates of depression have been on the rise for both boys and girls. It's unclear at this time whether this is a symptom of better assessment and acknowledgement of symptoms, or if there is indeed more stress that Native children are experiencing. As with PTSD, boys often tend to show their feelings by being overly aggressive, bullying, drinking, and experimenting with drugs. Girls with depression often tend to hide their feelings through suicidal ideation, sadness, and feelings of hopelessness. One common problem that tends to occur in boys is that they are often misdiagnosed with attention deficit hyperactivity disorder, ADHD, or conduct disorder instead of depression, which means that they are often not treated for their actual illness.
Someone was talking once about like Columbine and like a lot of angsty white kids will go out and sort of, not a lot, but there were a string of times when they would go out and they would take their anger out on other people, and how a lot of times in our culture we say we carry the burden for others, and how carrying that burden for your people, for your family, whatever, can be so overwhelming that you see everyone else around you taking their life. And also there's never been a sin in our, like, we don't have a Bible that says like, oh, if you do this or that, like, you're going to hell. To us, it's, so I mean, maybe a lot of them feel like they're going home. You know what I mean? It's too painful and they want to go home, so because in our way, when you die, it doesn't matter how you die. It doesn't matter if you're suicide or murder or cancer, you're going home to your people.
Empowering Native children. How to work with Native children in placement and how to help them feel secure and suffer the minimal amount of negative effects from their placement are important questions to answer. Some of the approaches that appear to be most effective for Native children include therapy, participating in cultural activities, and keeping the ties to the community intact, if possible, and if it's not possible to maintain ties with the child's home community, finding other healthy Native communities for the youth to connect with. Therapy is an effective tool in helping children to learn to express themselves in appropriate ways. Generally speaking, the therapist should be non-confrontational with tribal youth and understand the cultural background of the child. The therapist will need to be able to identify the acculturation level of the child and assess the impact that will have on a healthy identity development continuum. Therapy should focus on establishing trust with the understanding that it often takes more time to establish trust with Native children and their families. Well, when we look at adolescent identity development, and we want to have that as healthy as possible, it needs to be congruent with who that individual is on the inside. So, for example, when I first started working as a CD counselor, chemical dependency counselor, because I had the language, or at least some use of the language, I would often use that with adolescents, tribal adolescents. And even if they didn't speak the language, they knew what it sounded like, and it would be an immediate connection and a bonding. Maybe they heard their grandma speak it, or maybe they heard their aunts or their uncles or someone from their town where they grew up. And it's therapeutic. Just like sights, sounds, smells. If you think back in your own childhood, where you feel the safest, it might be your grandmother's home or your grandfather's home, and you might smell bread in the oven, or you might hear the sounds of a whole bunch of people talking, and it might be Christmas morning, and you can picture that in your mind. So that picture of safety and that picture of wellness comes with smells, sounds, and sights. Well, for the same is true for Dakota people. The smells might be sage, or cedar, or sweetgrass. The sounds might be the songs, the ceremonial songs. The sights might be the beadwork, the grandma making beadwork, the grandpa making beadwork, making outfit, making regalia, creating things for the home. It's not to say there's anything wrong with Euro-American developmental stages of life. They just aren't congruent for what many tribal people need as a healthy developmental growth. Encouraging children and families to participate in cultural activities is a good way to keep them connected to the tribe. Not all children have ties to their culture, but making it available to them is important. This connection can be maintained by attending powwows or going to community events, finding Native mentors to connect with the youth, or attending classes in tribal languages or tribal arts or crafts are other ways to nurture a positive identity in youth. Providing access to culturally relevant sights, sounds, smells, tastes, and experiences can be very therapeutic and help instill a sense of hope and self-worth. It is vital to design individual interventions to fit the needs of each youth while still maintaining some connection to a positive tribal identity. Maintaining those ties in children may also help decrease or avoid problematic identity issues that can and often surface later in life. It's an exciting time to work with Native Americans. This generation of American Indian parents is the first generation since the 1880s to have the freedoms of prayer and ceremony, access to health care, and the rights to direct the future for their children and people. Western Euro-American infrastructure and skills working with mental health issues, combined with the healing agents of Native American culture and lifeways, can be part of a new era. In the words of Sitting Bull, let us put our minds together and see what we can do for our children.